Welcome to the Low Carb MD Podcast. No one is beyond help. No one is beyond hope. Nothing said on the Low Carb MD Podcast is medical advice. Please consult your own doctor before making any lifestyle changes.
Hello and welcome back to the Low Carb MD Podcast. We're together again, Tro. Another week down.
Yeah, I'm interested. I think this is the first doctor of physical therapy we're going to have on the podcast. And it's honestly, I wish we did this much sooner. We definitely could learn to hear about people dealing with the post-surgical and orthopedic issues and are working hands-on with patients. So I'm excited, Brian, for this one. I know you're excited.
Yeah, I'm excited because there's some orthopedic stuff I like to talk about, even the pre-op stuff, or like some of the crazy stuff I'm seeing these days. So we have an expert here to educate us, Tro.
Absolutely. So we have Dr. Lindy, who is a doctor of physical therapy, and she did her DPT at Northwestern University in Chicago. And she has been practicing for 10 years, and she predominantly works with patients post-operatively, but she also does see the pre-op and the chronic pain patients. And
post-falls.
Yeah, and post-falls. And she is absolutely a believer in food as nutrition. She's got a YouTube. She's active on Twitter. And I think 2 years ago, I said, come on the podcast, and she snubbed me for 2 years, but she finally made it here. She finally made it out to the podcast. So it took only 2 years, Brian.
Yeah, and that's good.
You know what
Most
she
people
said?
put this up for 4.
She was like, Brian's so sensible, but I don't know if I can deal with you, Tro. That was what no, I'm kidding.
That's a common theme, isn't it? Isn't it?
It's nice to have
Lindy,
you here,
welcome.
Lindy. Yeah.
Thank you. Well, it's an honor to be here. You are two heavy hitters in this space, and I admire the work you're doing.
Yeah, explain your work to us. Tell us more about PT, like post-op stuff. And, I just want to raise, like, while we're talking nutrition, Tro, I don't know if you've experienced this too, but I've had several patients going in for like a knee replacement, and they put them on this crazy liquid diet thing that's all sugar and canola oil and stuff. Have you seen that? Like, is that just a California thing? Like, they're recommending it. Like, well, you have to drink this for 3 days before your surgery. I was like, do you want a post-op complication? You're like giving them sugar and canola oil. That's crazy. Do you see that too, Lindy, where you're at?
I do, and I most recently moved back to the Chicago area, so I see it here and there with some of the orthos in Chicago, but it's not that frequent. I did see it in California as well, so I think it's just all over. I had my own practice in California and definitely saw that. So, had to, dispel a lot of myths early on when patients would come in and be like, well, I was drinking this, so I should be good to go. It's like, oh my God, this is going to be a doozy, right?
So what do you see post-op, like, to help with this inflammation problem that we have? I mean, everyone's inflamed post-op. Sure. They just had their knee cut on or their hip. So what's your approach?
Yeah. So, I see patients when they're quite vulnerable, right? They had just, gotten a elective knee replacement, elective hip replacement, sometimes shoulder replacements. Those are less common. Or, something less expected, like a bone fracture, which keeps me very busy, unfortunately. And, I generally start with, day one, because we're talking a lot about, wound healing, right? That's like critical in those first couple weeks post-op. So it's an easy entry point for discussing like the power of protein and, why it's important. And people get that, right? So they get that. So it's a great way for me to just simply ask, because I'm with these patients for, a good 45 minutes to an hour, like, hey, like, let's just talk your diet. And most people will be like, the first thing they'll say is, well, I eat healthy. I haven't eaten red meat in like 10 years. So they usually say something like that, or, we only have 1 glass of wine a day, or, just like something that they're hearing, or like, I eat oatmeal every day, like the normal stuff that people really do think is healthy, right? And so it allows me to go a little bit deeper and say, look, let's break it down, like, let's see where we can add some more protein into your day. What are you eating for breakfast? Raisin bran. Okay. Do you like eggs? Like, are you open to that? Yes or no? And so I love that part of my job because people see why it's so important in the context of a healing wound. Now, I do get a lot of pushback though, and oftentimes people will look at me like, "Who is this lady?" You know, like she looks 22. Why is she telling me to eat eggs, right? You know, my doctor never talked to me about this, so it must not be important. So I get a lot of, "Okay, cool. Well, I really like my Cheerios or I like my Raisin Bran, so let me talk to my doctor." And I think that's where I kind of read the room and I'm like, this person just isn't ready for change, or, you know, they don't trust me, right? And I get that. You know, a lot of people have lost trust in this system. So happy to talk more about that. But that's generally like where I start with my patients in terms of, you know, the healing process and the critical period of a post-op patient.
I didn't want to jump on, I didn't want to step on your toes, Tro, but I think, one thing I would say is like I've always thought this, the approach that Tro and I have, if you're an orthopedic surgeon, you don't want to have bad outcomes. So if we had someone on a low carb, got their diet cleaned up before surgery, how much better is that patient going to be for you? And I've seen patients decide not to get surgery, so my knees don't hurt anymore once they got that inflammation down. But I'm surprised that more surgeons don't reach out to us and say, hey, can you make this patient healthy? I'll give you 3 months before surgery. What can we do to get 50 pounds off for rehab or whatever it might be and get the sugars under control? Yeah, it's surprising that approach isn't like, it's not part of standard medical care.
Yeah. And I think they just don't honestly know. You know, a couple of my close friends are orthopedic surgeons and like, you know, like we're cooking dinner together and, you know, I'll bring up seed oils. And I remember this distinctly. You know, one of my best friends, he's like, well, what's a seed oil? You know? And like, I think it's generally he just didn't know, right? So obviously, if he doesn't even know himself cooking in his own kitchen, he's not talking to his patients about that kind of stuff. And maybe seed oils isn't the greatest example just because that's like kind of controversial, but you know, the conversation just isn't happening. And I don't think that they were trained to do it. And they're so busy. And I don't think that they can like see the big picture like, oh, hey, maybe I could help more people if we could get this chronic inflammation to go away, right? I wouldn't need to give these gel injections. But I think that enters a conversation of like, well, can you get paid for that? Can you bill for talking on nutrition? And that's where I don't know the answer. So
Yeah, I don't think the surgeon's going to get paid for that, but they may send them to someone else going, look, I want my patient to have good outcome. I mean, surgeons are worried about their numbers, right? You don't want to have
right.
high mortality. The worst scenario, someone gets their knee replacement, then it gets infected, and then you got to take it out. They put a space. It's a nightmare. A year of your life's gone, right? You're going to be laying in bed for a year.
Right.
And then you're trying to fix the problem. And so I think it's such a huge issue, especially now as our population is so ill. It's poor protoplasm going into surgery.
Right. And like, you know, my observation, and I don't have, you know, data on this, but I do see a clear difference in those post-op patients that are eating a real whole foods diet and those that are, you know, eating what they, you know, deem to be healthy. And it's just different, you know, like those people are on, you know, opioids a lot longer because they're in pain, right? And I don't necessarily think it's the post-op, like acute good inflammation pain. I think it's the chronic underlying fire that led to this in the first place.
I'm curious, I think you're on the end, at least I'm not sure about this, but maybe you can correct me if I'm wrong. You're seeing a lot of patients post-operatively, right? Post-injury, right? Don't you wish to some extent, and I know this has become more and more part of the physical therapy practice, the idea of prevention. We have ACL sort of prevention programs in young female athletes because of this sort of their anatomy and their tendency to get injured. We have, this idea of prehab, is becoming more and more mainstream. Where do you think the field is going to go in terms of this idea of physical therapy potentially being a preventative practice more so than a sort of post-op practice? I mean, it must kill you morally. I'd imagine it kills you to see people after they have, that hip replacement, after they have, that knee replacement. And yes, their lives are probably better. They're out of pain but gosh, like, wouldn't it be amazing if you had access to those people 20 years prior or 30 years prior? And I don't know, has there been any advancements in the field of physical therapy with this concept of prehab? Can you educate us on that? And maybe educate us even on if maybe I was wrong about the ACL prevention. It's the last I looked at the data, but tell me if I said anything wrong.
I think you're right, but I think that it's just in its infancy, right? You know, like for example, the issue of even just prehab for like a patient who is like on track to getting a knee replacement. Prehab typically looks like working with a therapist for like a couple weeks to like learn the exercises. And I think it could just be so much more robust, right? It could be maybe like, you know, like, hey, let's try this approach first. Yes, go learn a couple exercises. I mean, you could honestly just do that part on YouTube. Like, love my profession, but like that part's easy. But like, hey, like, let's link you up with a like a good dietitian, right? Right. Not just like someone who's gonna promote Booster and Sure for protein. And like see where we go, right? Like, let's try this, like give it a good go for like 6 months, right? And come back to my office. I'm saying like if I was an orthopedic surgeon, come back to my office in 6 months. You know, if we're nowhere with just some like exercise and, you know, some simple modifications to your diet, let's try a cortisone or gel. And if that doesn't work, you know, like let's look at surgery as the next best option. And I think what we would find, you know, and I think a lot of people would predict this is, you know, I wouldn't need those surgeries. Or maybe you don't need that surgery when you're 60 and that summer your daughter's getting married, right? And you don't want to do a knee replacement and all the fun life stuff. Maybe you want to put it off until you're 75 and truly actually need it then. So I think that there's a lot of room for growth, but I don't see it happening. And, you know, even myself, I'm not really a voice in that fight. I am so focused on just helping people turn their diet around that, you know, I haven't really looked at the big picture for, you know, my own profession in that way.
Well, how do you deal with the mental part of this? So for me, I just saw a patient this week, as a matter of fact, and you know he was kind of a little stressed. He just had a total shoulder replacement. And I said, "Why are you stressed?" He goes, "Physical therapy starts next week." Like, oh no, it's gonna hurt, you know. And so a lot of people avoid. Like surgeons will tell you if they don't do the therapy afterwards, the surgery's not successful a lot of the times. So how do you get to the like? How do you deal with that person who's in pain and you're trying to get them motivated to use that
Yeah.
part of their body?
You know, that part's actually been easy for me. I think for a few reasons. I think that there's like this big idea that therapy is really painful, but it doesn't have to be, right?
Uh-huh.
You know, like I always tell my patients, especially like with a knee, it's really hard to bend your knee right after surgery, right? And people are afraid, right? And I'm like, I'm never going to push you, right? If you tell me to push you, I will, but like you are, you know, you're steering this ship. So I'll tell you where you're at and, you know, tell you if you're behind, but like I'm not physically going to push you if you're not ready. And that kind of relaxes people and then they're like, okay, that's cool. Like I can do this, you know, I can do this. So I think it's just like resetting expectations about this will be hard, but you know, you're in control of how hard it has to be. So that part's actually pretty easy. I think the mental exhaustion just comes from, you know, the uphill battles like again, more related to nutrition. Like last week, had a really, really awesome, you know, smart guy. I'm not affluent, but I live in a very affluent area, right? People are running, you know, big companies, like the biggest companies in the world. So they're smart people and they have high expectations, but they also feel that like if my doctor went to Yale, everything he or she says is right. So I had an example last week, you know, like this guy's in a lot of pain, had a lot of swelling post-op. And I was like, okay, let's talk about your diet again. Like, are you ready to give up your breakfast cereal? Like, it's not helping you. You know, he also has like elevated blood sugar, and he's like, okay, he's like, I'm meeting my doctor, you know, next week. I'll talk to her about switching to like eggs for breakfast. But he was nervous about cholesterol, right? So, you know, I'm kind of excited, you know, maybe have another one transitioning into like real whole foods. And I saw him the day after, and he said, you know, my doctor, quote unquote, said it's bullshit that Raisin Bran is contributing to my knee pain and definitely not to my prediabetes. And that's where I'm just like, okay, like, you know, that's where I go home. I look on Indeed and I'm like, get me out of this. Like, I'll sell anything. like I just want to leave the profession, you know, because like your own colleagues, you know, you want to put your trust in them, but they literally say things like that. And then you look like the fool, right? Promoting just like real whole foods.
Yeah, it's a hard thing. You know, I think we all went through that. That us being physicians was a little bit easier because we could sit down and go, look, like let's show you the data. Let's go through these studies. And even then, some people have their minds so made up that they're not going to change what they're doing. It's
Yeah.
a you know, I know Tro's been through that where doctors will call and yell at him. because of
Yeah.
what he did. I've had
Right.
nutritionists or therapists yell at me, and I'm like, look, I'm just showing you, here's the data, but they don't want to hear the data. They're not really interested because they go, this is the way we've always done it. So we're going to keep doing it. Yeah, but it's not working. Like we're
Yeah.
getting sicker as a population.
And especially like when you're like, this patient literally said to me, and he, I don't care about this stuff, but he was like, your school's really good, Northwestern Feinberg School of Medicine. Yeah, it's really good. He's like, but my doctor went to Yale. And I was just like, dude, it's just like a way to like silence me. Like, little girl, you don't know what you're talking about, right?
Yeah, that's a hard thing to be up against too. And
It
especially when you're
is.
right and you know the science and people think you haven't read the science for the last 20 years or something.
Right.
Yeah, it is it's just a frustrating thing. But what you have to realize we all have to realize there's certain patients who are gonna listen and do what we ask them to do, and other ones are gonna say, just give me the drugs, just give me insured, let me just do what my Yale trained doctor said.
Totally. And I think that, all three of us have probably learned that like we do have to just let those people go and focus our energy on the ones that really want to change because that's what keeps us going, right? So, but I'm not great at that yet. I'm still like upset about that from
Yeah,
last
you don't want to let
week.
anyone get away because you're like, I can help you. Let's just do this
Right.
together. And it is a frustrating thing. But I've heard it, my Italian patients, now we have Anna Bocchino making low carb Italian cookbooks. But I remember I had Italians go, look, doc, I'll just die a little earlier. I'm okay with that. Right. And when you're younger, you don't think that, but you go, here's what's coming, and,
Right.
I think about that and surgeons like, fructose no, right? Gary Fetke. And he goes, look, I'm amputating your feet. He was taking a pay cut to help people because he says, look, we got to stop eating these sugary cereals. And he goes to 3 years of trial for this. Right. And it's
Wow.
amazing how ingrained these things are into our system.
Yeah.
I want to come back because these are smart people. You just mentioned, highly affluent people who run corporations. You know, um, this is what I've focused on over the last several years. It's, reaching those people, and if you can convince them, you can have a huge impact. So I wouldn't tell you to be disenfranchised. I would actually lean in. Give them the study from Verta. Say, here's the study from Verta showing the osteoarthritis pain decreasing. Here's the study from, you can give this to your Yale doctor. Ask me tell them to contact me about what they think. Um, I would say lean in because when those people's lives get changed, their entire company is then going to get changed.
Right.
And I wouldn't, like, gosh, you're out there. I see the comments you put out there on social media. I can tell you're wide awake. You have a doctorate degree. You should have zero imposter syndrome to go and, tell that person, I don't care where this person's from. Yale has made a lot of mistakes, right? Like starting
Right.
at the Tuskegee experiments that they were involved in, all the way up to, so my advice is, just bring the data.
Yeah.
Just have the data. Like, here is the paper on osteoarthritis showing that low carb improved pain symptoms compared to low fat, and that is so powerful. And the other thing that that's helped me, and I'd love to hear your thoughts about this, is, if I was stuck in a system like you, first of all, you know, uh, just put a like a flyer in your office saying, if you want to decrease pain, lose weight, and feel better, ask me about nutrition, right? Like, big sign. And then you don't have to like talk to anybody about it,
Yeah.
and then they come to you, and you're assessing that readiness to change. I think there's something in that corporate America sort of type of person that they think that the science is, the quote unquote, the science is everything, right?
Hmm.
Like, the knee replacement will solve my problem. So I would tell you, don't lose hope. You can have an impact. And in the Chicago area, you have people like Tony Hampton, who are not far from you, who are leaders in the healthcare systems, who are making huge inroads with this. So I wonder if you can leverage, some of these other resources and their results
Yeah.
to reach those people. I'm curious because I'm sure even in the physical therapists that your colleagues in the orthopedic realm and the physical therapy realm, there's not many people talking about nutrition. So how did you come to that point? I mean, that must have been a journey in and of itself. And I wish we sort of tackled this a little bit earlier, but I'd love to hear that part of it, unless Brian, you have another question that you're itching to get
No,
to.
I was just laughing because I was thinking to myself, I'm like, ask that Yale trained doctor how much nutritional training they've had in their entire life. Right? They probably had like one lecture maybe on low fat diet, and that was probably it. Because I know how we were all trained. So it was never really something thought about. But now when you start seeing better outcomes, and I think that's going to be the point, as you go, look, if we do studies showing here's one group doing a low carb whatever carnivore type approach versus standard American diet. Let's look at how long it takes them to go through rehab, right? And what their experience is like. I think we just need more data like that to really compare, to say, look, this is a superior approach.
Right. And I think that that's, where it's headed, but, it's just still in its infancy. And, we're trained similarly, like, right? Like I went to Northwestern at Feinberg, medical school, and we had, similar maybe to your experience, we had 2 hours of talk on nutrition. Compare that to a semester of pharmacology, and we're not even allowed to prescribe medication, right? So you can see where like the disparity even right there, right? Like, why do I need to take a full semester for my doctorate program in pharmacology if I'm not even prescribing medication, right? And only get 2 hours on nutrition. So, I didn't learn it in school. I have a lot of respect for where I went to school, but there's a lot of room for growth there. Where I learned it, I was very fortunate. My mom and dad, I came from a really big family. I had 5 sisters, and they cooked. So I grew up with parents that cooked and believed in eating food at home. So I'm very lucky there. And I always thought I was eating healthy. The idea of what I thought was healthy has just evolved over the past few decades, right? I was typical 19, 20, 21-year-old, and I was very passionate about the environment and my body. And I was like, well, I must be a vegetarian. So, I had started there, right? Did the whole vegetarian thing, added in fish. And then, suffered debilitating migraines for about, close to 12 years. And they were frequent, like twice a month, nothing would help. Medication wouldn't help. And it was impacting my life, right? Not just the way I felt, but, my ability to work on those days or my relationships with people in my life that I love. So it was my early 30s, someone, was like, hey, have you tried Whole30? And it was for a whole different reason. You guys remember Whole30 at the time?
Oh, yeah.
So it was kind of like the gateway into opening one of my eyes to all these problems with big food. Again, I thought I was eating like this perfect diet, but I was eating a lot of like vegetarian bullshit, just like packaged stuff that was, like made with canola oil and God knows what else. So, I did Whole30 and it was amazing. Like, I did it just because like my girlfriends were doing it, right? It's like nothing to lose. Everyone was like, hey, like, let's look fit for the summer, lose 5 pounds. I didn't need to lose 5 pounds. I was 120 pounds, right? And so I did it and I just couldn't believe how it felt. And I was like, holy shit. There's sugar in everything. There's sugar in my barbecue sauce. There's sugar in ketchup. You guys have probably had your own epiphany. So that was like step 1. And that really changed my diet to like mostly real whole foods. And I started to feel better, but I didn't really get the whole protein piece that I really needed with the Whole30. I think there was less emphasis on that and more emphasis on like taking out, the bad stuff. And then fast forward, I'll make this part quick. I was very into the COVID vaccine, just a huge proponent, very liberal, very left on this, and went to get my my booster as like a healthcare provider, to keep my job. That was a requirement for my job. And I got a 15-day migraine. I thought I was having a stroke, and in and out of the ER. And my life turned upside down. Couldn't work. It was scary. It was like, as someone who had migraines, for a good 12 years, this was the first one I'd had in like 7 years. So, and it lasted 15 days. And I was like, this isn't right. And so I found this amazing neurologist in Orange County where I lived, and she ran a migraine clinic, and she's like, this is because of the booster. And I thought, well, this woman's crazy. She's an anti-vaxxer, And I started to listen to her a little bit more. And that's when I really opened up like my second eye to this problem. And I was like, something's got to change. So I knew that wasn't working, and I really kind of lost trust in the system at that point, right? And I was pissed. I was pissed at the emergency room bills that I was responsible for because I like had done all the right thing, right?
Yeah,
And
yeah. That's the tragedy is that so many people thought they were doing the right thing. You do what everyone says safe and effective. That's what the mantra was. And we were seeing stuff in our clinics too. And so that's why Tro and I were saying well, we're seeing something different than what they're saying. When they say you can't get it. I mean, all these things that were controversial at the time, they're not controversial anymore, I don't think. But I had friends go through this. I have friends with myocarditis, pericarditis that triathletes now they can't walk up a flight of stairs. And when you see that, you go, "Oh my gosh, it's our responsibility to at least stand strong on something and see what we're seeing clinically."
Yeah. So, that's really when I started to lose trust in the system. Cause again, like I was really proud to get that booster and like I wanted to keep my job and it was mandated that I get it if I want to keep working with patients. And that was my living, the time I owned my own clinic. And I also still was like in the regular system and I needed my job. And then around the same time, around that, when I was just angry, I met Max Lugavere just like at a party in LA. He's the host of the Genius Life podcast and just started listening to his podcast and was just introduced to people like you guys, right? And that's when I really like entered this circle. And I think the culmination of those three things just woke me up and now I just can't unsee it. So that started my health journey. And then I really started talking about it with my patients, right? Because I could see where the inflammation was coming from. I could see that the diets that they were eating were causing their hypertension, their diabetes, and the list goes on. So yeah, that's how I became a foot soldier in this battle.
Oh, one of the things I always wonder, when you, as a healthcare provider, some of these thoughts that, hey, nutrition is powerful. Gosh, maybe what we were told about the COVID vaccine and its safety was overstated. How have you, like, this has clearly been a long journey. So I'm curious, how is it like going back to your, let's say, vanilla colleagues, I mean, that's gotta present some angst.
Yeah. Well, you know what? I actually don't really feel like I have colleagues anymore. I opened up my own practice in 2020 in Southern California. I closed it because my boyfriend had to move back to Chicago. So here we are. So I closed my practice and now my office is actually my patient's home because, I see them in the first 2 weeks after surgery. So I go to their houses. So I don't run into colleagues. So fortunately and unfortunately, I don't really get to discuss this with other people, but I do hear what like I'll have a patient that'll be like, well, the nurse said I have to, the same nurse that I'm working on, the same patient. The nurse, told me to like load up on Boost. Like, oh my God, or Ensure, so I have to kind of bite my tongue sometimes because I don't want to step on anybody's toes. But at the same time, like my ultimate goal is to help that person. So yeah, I don't know. I think my colleagues right now are just people like you on Twitter and on the internet, and that's actually been better. It's actually kept me in the system is Twitter, or X, whatever you want to call it. And it's the truth, right? Everybody people like you and in this circle, they've given me hope that there are other people out there that want to change this.
Yeah, I think the tide has turned. There's no question. We've been talking, the tide's going to turn, it's going to turn, it's going to turn. Now it's like, it has turned, right?
Yeah, it's turned this week, right?
I don't know any doctors who are like fighting this fight. I mean, really, honestly, I don't know any doctors who are continuing to get boosters. I don't know any personally that I've talked to. They're like, oh, no way in hell I'm getting that, right? They know now, and you see the stocks going down, all these things. But, I'm not just saying that. I'm just saying, in medicine, we have a responsibility. And in California, the reason I'm in Arizona right now is California passed this thing called AB 2098. And I'm like, this is crazy because I couldn't discuss the risk and benefits with my patients. Like, and
Are you serious?
Yeah, because if you said anything bad about it, and I still have the letter saved on my desktop here from the American Board of Internal Medicine saying, hey, if you say anything bad about the vaccine, we'll take your credentials. You're done. Wow. You go, wow. I wonder if those guys are going to hand in their credentials. And this was early on when they signed it. We didn't have all the data yet. So I couldn't tell my patient in good conscience, yeah, long-term, no problems. How do I know we don't have long-term data? No one could say that, right? Unless you're God maybe, and you can predict the future, you're a fortune teller. So there was stuff like that they say, you can't have any reservations. You can't, because you're causing hesitancy. And you go, well, Should we be hesitant in something that's brand new that we haven't really studied, that we don't understand yet, just like anything? And so I think that's a hard thing when you have critical thinking and you go, oh, these things don't make sense. Like, Tro and I questioned this 6 foot apart thing. We go, where do you get the data? Where's that coming from? And now 3 years later, they go, oh, that just kind of fell out of air. Like, even now, if you talk to people and you go, is that 6 foot apart help? Oh yeah. But they admitted they just made up the whole thing. And so by saying that, you were dangerous and a threat to society. And so I think it's hard, in physical therapy. I know tons of physical therapists, they couldn't even see patients because they had to do it remotely. And how are you going to do that remotely?
Right.
I mean, what you do, there's a part of connecting with people and putting your hands on them and helping them and, being there. So, physical therapy had a huge step back. And there's still physical therapies now who just do remote the whole time. They don't even touch the patient. And doctors the same.
Yeah. It was part of the reason I opened my clinic, and it was 2020. So I still wasn't awake yet, but I was like, well, f that. Like, excuse me. I was like,
Tro's here. Yeah, Tro's, it's all right.
So here we are. I was in Newport Beach, never opened a business before. I was like, I guess sign me up for Medicare, and like open my doors and started seeing patients in person. Like to the people that wanted, like that was hard, but I wasn't doing anything else. No one else wanted to see me because I was like a leper because I was seeing patients, and all my friends have little kids, and we just didn't know enough back then. So people were afraid to be around me. So I was like, well, I'm going to use this lonesome time to start a clinic.
Wow. And that's I opened my clinic in 2020 also in June.
Oh, wow.
And I had just resigned. I'm like, what did I just do? Once COVID hit, I was like, holy cow, what's going to happen? But fortunately for me, there was a lot of closed-minded doctors who were firing everyone because it was going to affect their bonus if they didn't have a certain percentage, right? And we know that now. So they were firing patients left and right that they were taking care of for 20 years. So they're calling me crying. I said, come on in. No problem.
Wow. Right. Like, I'll see you. Right.
And I'd meet with someone for half an hour and they go, okay, doctor, I have something to tell you. I'll go, what? I'm not vaccinated. I was like, oh no, I can't be your doctor then. And then I'd laugh and go, me either. We're good. Don't worry. Right. So it was such a hard thing. I mean, people were lepers, literally. Like they were like, we're not seeing you. We're not helping you. Go die somewhere. And it's horrific. I mean, if we don't learn from history, that's one thing is like, we can't just abandon our patients like that. And they were held up as Tro and I noticed it. They were held up as heroes. They're heroes. They're firing all their patients. Like, that's not a hero.
Right.
The hero takes care of their patients, says, here's the risk, here's the benefit. I'm going to let you use your autonomy to decide. Tro, you've been quiet.
Oh, I'm just like trying to put it all together. 2020, you gain some courage. You see that the sort of nutrition is the way. Then 2022, you experience, I guess, a 15-day migraine. It just, I know, I'm guessing prior to that, you were probably like, you just want to be you just want to be good at what you do. You want to help people. And then it starts to crumble, right? That picture of the profession starts to crumble. So I'm trying to put myself in your shoes, Lindy, and just try to understand what you were going through sort of emotionally, professionally. You're like, get me out of the system. And then you sort of even wake up to the system even a little bit more, and you really start to understand, well, wait a second, why my colleague's doing this. And you're in the epicenter, California and New York were the epicenters of sort of the authoritarian approaches to all this. So it sounds like that was, these two things are like huge shifting points for you. And I'm just wondering how you're going to, I mean, like you went through 8 years of school, college, doctoral degree. What does the future have for you if you can't turn to those systems? You don't feel like you connect with the orthopedics, if you don't feel like you connect with other physical therapists. It's hopefully we can get you into the Society of Metabolic Health Practitioners and other communities, get you our app so you can go use it and give it to your patients. But like, how do we get you? What does the future have? Like because right now the picture is really bleak. The listener who's listening is like, oh God, like I don't want to go to, PT school. I don't want to go to medical school. It's all bad. So I'm curious, how do you pivot from here? And you mentioned you had a plan. I'm curious to hear that plan. How do you bring back health to your patients, and how do you practice in a way that you're proud about? I mean, we've heard of Fedke, as Brian said, we've heard of Unwin. What's your plan? I'm curious to hear that.
Yeah, I mean, well, one, I'll start by saying like I'm open to anything that I really think will help people. And I don't think my current path is the answer to that, right? It pays the bills right now, and that's about it, right? So I'm just trying to keep my head down and help the people that are open to change at this point and channel my energy into those. And I still get a lot of value out of that. But I don't think I'll help enough. So I started my own YouTube channel about just teaching people like the basics, getting back to cooking at home. I think that not only is it good for the wallet, but it's good for metabolic health and it's good for the health of your family, right? Sitting down at the dinner table with your kids or whoever's at home, right? So I'm really passionate about that and I don't want to let that go. Still building my channel, so it's not enough to live on yet, but even as that grows, I'm open. Yeah, it's like metabolic society you speak of. Yes, like absolutely opportunities like that. I do have a few private clients on the side that I see in addition, and that helps keep me going, like the few that are like, hey, can I see you after this? And I'm like, sure. Yeah. But I do have ground rules for that. I'm like, listen, we're going to talk about nutrition. We're going to exercise. We're not going to I don't want to say make excuses, but, keep it positive. Like this is, I'm very picky about who I will work with privately, right? Because it's, one-on-one, it's a lot of time to work with someone, right? A lot of your own time. And um, in addition to that, in the new year, I don't know what to call it yet. I don't necessarily love the term health coach, maybe health consultant. I don't know, but taking on, those people that are ready for change that just haven't found the answers or the solutions from their traditional like primary care doctor. And open to like, and will help people, right? Like, so I've been building some food guides just with like simple recipes and then just simple practices that I've learned from, the greats like you guys or Dr. Jason Fung about here's some other strategies that you can do to, lower your A1C, reverse your, type 2 diabetes, um, get off your blood pressure meds, right? Still want you working with your doctor. I hope your doctor's on board with you working with someone and doesn't feel threatened by that. Because that is an issue that I run into a lot, right? Primary care physicians getting threatened by like somebody working with someone else, but that's not my problem.
Yeah, it's amazing how much tribalism. I've always been really intrigued by this. I personally go to a chiropractor, and she loves physical therapists, and they work together, and they go, "Hey, let me adjust them, and you keep them in line." But there's so many who say, "No, don't go to there. Don't go to the
Right.
physical therapist. You need to go to the
Yeah.
chiropractor. You need to go." And Western medicine guys like us, we're the worst at treating back pain and knee pain and things like that. We're the worst possible person you go to, unless we're talking about nutrition stuff. But classic Western, and it's like, hey, you got to go. You're having chronic back pain. Let's see if we can work on your posture. And the other thing you were talking about, and it's a huge, huge issue. People don't realize is falls in the seniors. We're out of shape. We have no muscle mass. We're not taking care of ourselves. We got that big belly that's making us fall, and no one's addressing that till after they break a hip, and now you're trying to fix this damage. And people who don't know, if you're demented and you break your hip, the mortality is higher than lung cancer, right? It's a bad thing, and we have to prevent that for our parents and our seniors.
Yeah. So yeah, I actually want to talk about that in more depth, if that's okay, in just a second.
Absolutely.
Like, just kind of like wrapping up the other thing. Like the other thing too is I've been speaking with Callie Mean, so deeply involved in just other advocacy work, right? And I'm grateful to be a part of that. I was introduced to him when I was in Grace's documentary, and he was also in that. You guys have known Grace. You guys interviewed Grace, right?
Yeah, she's great.
Okay. Yeah, I was in.
We haven't got Callie yet, Tro. What's going on? We got to
It's only a matter of time. He's got to come on.
It's a matter of time. All right. We'll love it.
Yeah,
put a bug in his ear.
But yeah, and just open to other suggestions. I don't have an answer yet about what my path forward is in terms of helping people, but I'm confident that an opportunity will come my way that seems right. So falls and fractures. So that is like a big one, right? Have either of you had a loved one that's had a fall and fracture? Maybe a parent or grandparent?
My son just had a fracture.
Patience.
But no.
Oh, well, that's probably
Yeah, no,
different,
I have
right?
actually. actually. Yeah.
Okay. Right. It can be life-changing, right? Yeah.
It's terrible. Yeah, it's huge life change.
Yeah. So, that story is a little less grim than like elective surgeries in terms of like the talk of nutrition. People do have a little bit more fire under them because they don't want to keep falling and fracturing themselves because it's expensive, right? Like it just takes away your freedom and your independence. So what I will say is good and happening in that space is there's a lot of talk of, vitamin D3. I think room for improvement. Many doctors are still just pushing calcium, right? And we know that there's just like a lot of controversy around that. And I still don't know. I'd like to hear your perspective as physician.
There's no data. There's no solid data on calcium replacement.
Yeah.
Bro, do you see any? I mean, vitamin D3, yes, because you'll absorb more calcium and be able to use that in your bones, and K2. So yeah, calcium, everyone's on, their stomach's messed up and they're constipated. And you go, okay, is it helping you? Is it worth the risk and benefit?
Right, right. And then I think the whole link to, is it contributing to, atherosclerosis, which that part is scary to me. And I don't know enough about that, so I would like to hear more from you guys on that. But like no one knows about vitamin K2, which is kind of sad. Because that's huge. And like if I know
magnesium has a huge role in bones, also bone density.
Right. So, I think there's room for growth in terms of like what patients are being advised about, but there is at least like, hey, take vitamin D3 and try to get some resistance training in. But I don't see a lot of follow through with patients because again, these other things, like it's like, well, where would I get vitamin K2? And it's like, well, you could get Greek yogurt or like, pasture raised eggs or, grass fed ground beef. And then people are like, well, then I don't want my cholesterol to go up. I'll just take my chances. So, I don't know, it kind of circles back to the same problems, but yeah, falls and fractures are a problem. And I think a lot of it has to do with, just becoming frail over the decades, right? So, women historically, we haven't been told to do resistance training, right? So we get to our 70s, 80s, 90s, and we don't have any muscle mass. And like, if you don't have any muscle mass, you're going to fall, right? And if you haven't been doing resistance training, it's very likely that your bones aren't healthy, especially if you've been eating, the standard American diet for decades. So I think there's more hope for the coming generations, in terms of this. I think we will see less falls and fractures if we can get it together. But, folks in my parents' generation, it's really hard. It's really hard to right the ship after a certain age.
A big believer, and I talk about this in some of the patients coming in on that 6th, 7th, and 8th decade.
Mm-hmm.
A lot of my patients are highly motivated. They are looking to maximize, aging with grace and really maximize their vitality as they age. And unilateral movements is a big thing. I talk to them about unilateral movements. The Bulgarian split squats, Bulgarian deadlifts, Romanian split squats. I always get the countries mixed up. And, doing a lot of lunges, doing a lot of hip mobility work, basically and I think that plays a huge role in fall prevention. I wonder if you could talk about the data on that. But, I'm a big believer in really getting the unilateral strength up, because if one foot is knocked out, you really want that other foot to be strong. Often we're talking about doing side planks and just really, beefing up the entire core, hip, glute, and quad and hamstring. But what's the data on all this? Am I just blowing smoke? Is there any data that we can prevent falls?
And even if there's not data on like unilateral strengthening, I'll tell you what, all three of us, we could do squats all day long. Try a single leg deadlift and you're going to find out where your weakness is, right? So the unilateral movement is huge because everybody, even you guys, go home and try this today. Try each leg and you're like, oh yeah, my right leg's weaker, right? When you try single limb exercises, be it, one arm stuff or, one leg stuff, you can see where your weaknesses are. And that's when like the light bulb goes off to be like, oh, okay, I see why I keep falling, right? Like when 2 feet are on the ground, I'm cool, but my left leg, just can't handle this stuff, right? And I fall. So I think that that's great. So I hope that you keep promoting like that single limb work or unilateral, or however you want to call it, because it's critical. Because then you can really just see where your weaknesses are, so that you can, have something to work towards to reduce your risk of a fall.
other tips for fall prevention? We've been talking about that. I'm just curious, what are your, biggest bang for the buck, for that patient who's listening who wants to prevent that fall?
Yeah, I always liken it to like a puzzle, right? Like it's not full unless you have all the pieces together, right? So it's all the things, right? Like first and foremost, making sure going to your physician regularly and making sure that you're like not on duplicate drugs, right? Because polypharmacy is it's a really big risk factor for falls, right? Like if your medicine isn't right, like you could be really dizzy and people fall, right? So that's number one. So definitely having a conversation with your doctor, like, hey, are we on the right medication and all that. Two, resistance training, strengthening. There's no replacement for it. So, and I'm not talking like Pilates. Pilates is lovely. It's great, for flexibility and all that. But like you need to like lift heavy for you weights. So some sort of like resistance training, strength training that like you're really taxing your body and like using like dumbbells and machines that are weighted. Um, Walking is key, right? Like everybody has to walk. So I think there's this misconception that like if you're not a runner, like you're not getting, cardio in, but like people can walk. So just to kind of recap, talking to your doctor about your medications, strengthening, walking. This one sounds silly, but like mobility, right? So like ankle flexibility, that's something that we really lose as we get older. And if you think about it, the ankle has like multiple planes of motion and is really imperative in our balance and like our proprioception, meaning like where our brain perceives our feet to be on the ground. Um, and then just like, again, overall, like, getting enough protein so that you can build those strong muscles, right? And then, getting all of the things that you need for like bone health, as we like talked about a few minutes ago. So I'd say those are like five big things. Other small things, just like, not resisting things that are going to help you. Like after a certain age, if you're 80, just put a grab bar in your shower, right? Use the handrail when you're walking down the stairs. Take your rugs away. Just be sensible and just know that like you're not what you were when you were 17. Like if you fall, it's tragic.
You say that for 80. I mean, gosh, I was doing some martial arts kicking the other day, maybe just a couple months ago, and I was doing a roundhouse, really high roundhouse,
Mhm.
and I just planted onto the floor. Gosh, I think I broke a rib, although I didn't
Oh,
check, but it sucked. It
yeah,
sucks to fall. Even at 40, it sucks to fall. I
right.
can't even
I know little
imagine. I
kids, you
can't
see little
wait, hold
kids
on.
run, they fall on their face and they're just like jump right up like nothing happened.
I can't even imagine Brian at like 88 falling,
I know,
what
you
that would
imagine
be
that?
like. That would be she doesn't she doesn't know
But
whether to
yeah,
laugh or cry,
Yeah,
Brian. You know?
but you're
because
right.
he's
Like
only 86.
we don't have to be in our 80s to feel it. Like, anything after the age of 25, if you hurt yourself, it's going to take a while to recover, right?
Yeah, and do you have any other modalities that you like for like post-op? Any other modalities that help with that inflammation in that joint? Like laser or, pimp mats or
Yeah.
anything like that?
Honestly, like I like to keep it simple and like elevation, right? Just like letting gravity assist you. Right there, right now, there's a lot of controversy on cold therapy in the setting of like an acute, elective surgery, right? Because
Hmm.
some folks are saying, like it's reducing blood flow, which is going to delay healing. And then there's other people like, well, these people are in pain and they're on opioids and we're trying to get them off opioids. I kind of fall somewhere in the middle. I educate my patients on, the pros and cons of each approach. And then people usually just figure out what works best for them. So
Can I tell you,
Good, good.
the cold plunge was the only thing to help my back pain. It was
that's
the only
great.
thing,
Yeah.
and I you know I can't say enough about it. I'm curious. I just want to sort of go down the line. We got you here. We got a real doctor here, which I've always had these questions, and I'm not up to date on these, and they still linger in the back of my mind. The last I looked at the PRP data for sort of joint healing and tendon healing and this and that, maybe 15 years ago, I wasn't impressed, 10 years ago, but I haven't really looked at the data in 10 years, and I don't know if you have. How do you feel about, PRP as has it been debunked? Can you update us on, is that something that
Yeah,
somebody
I mean,
should consider before surgery?
I don't think that there's a lot of cons other than it's really expensive. So, in the small pool of people that I've met who have tried it, I haven't met one that's helped them, but that just means I haven't met somebody that it has helped, right? So, I think that if you have the resources and you've exhausted all of these other things and you want to try it, go for it. But most people don't have the resources, right? It's really
Mm-hmm.
expensive, right? Because it's not covered by insurance. At least from my understanding, it's not
Mm-hmm.
covered. So I don't think that the evidence is compelling enough to go, give someone $2,000, which people are doing. These people, like people on a budget. So I wouldn't recommend that. But like, if you got loads of cash to throw around and like fly to Vail and go to that like Stedman clinic and get PRP, good for you. Like,
Sounds like California pricing. We've seen like, anywhere from 400 to 600, but yeah, so not clear. The data's not
Have
clear.
you seen anyone that's helped Tro?
I've seen some people that it's helped, but again, nominally, and
I haven't seen anyone not ultimately end up getting a knee replacement after doing it. So you're like,
mm,
okay, right?
yeah.
You're buying time, maybe. I don't know.
Well,
I
this
haven't
is the
seen
second
anything
question.
fantastic.
The second question I have, because I have tons of patients asking about this, and I've been meaning to dive into the data. Even more, cutting edge than that is now, stem cell therapy.
mm.
Do you know anything about that? Do you have any opinions about that? Again, I know nothing.
Yeah, I mean, I know that it's heavily regulated here. So if you want it, like people are going to like Tijuana, you know what I mean? Like
Yeah.
literally. And that's fine. Like I love Tijuana, but it's
Is there
really
data to
hard.
support it or
I mean, I think it's in its infancy, right? I think that there's a lot to learn. I don't have any patients that have tried it. I do know that, and I've heard a couple people that are experts in other countries that are researching it, that they seem to have a lot of hope. So I think it's promising, but I think it's again going to be one of those things that you do in conjunction with all of this other stuff, right? Like get your metabolic health in order, start a strength training program, start walking, start sleeping, right? Looking at your stress. I don't think it's going to be like, the one thing that prevents you from getting like a joint replacement or fixing like your back pain forever. I know you guys know Max Lugavere. We were talking about him earlier.
I don't know him,
uh,
but I know of
I
him.
know him.
Yeah.
He's like the podcast. He does a podcast. He wrote a
Yeah, I mean,
book,
I
I
don't
A
think,
like
lot on
right?
Twitter. Yeah.
he's not like
Yeah.
my friend or anything. I've just only met him once, but I listened to his show. He, like you, Dr. Cho, he's had back pain for like 10 years. And he was just like, you know what? Like had this stem cell guy on my podcast. He found a clinic in Mexico to get it. And he reported a couple weeks ago on one of his episodes, he's like, unfortunately it didn't work, but he's like, I'm glad I tried it, right? And he acknowledged like, hey, it was pricey, there weren't a lot of cons, so I just gave it a go. But I'm here to say it didn't work for my body. So, I'm just kind of back to the drawing board here.
Yeah, I don't know what to believe in. I mean, Tro, have you come across people wearing these little patches like this Life Wave or something like that? It's supposed to
Uh,
help with stem cell. You know what I'm talking about?
No.
I don't know what you're talking
It must
about.
be a
No.
California thing, but I've seen several people and they swear by it. So I'm going to look
Hmm.
more into it and talk to people who know, but it's a weird technology. But you just change this little patch you put on. It's like a little like estrogen patch, right? And they wear it.
Oh,
So it's
interesting.
very interesting. I'm going to look more into it, but I've had several people tell me that they're like life-changing for them with back pain and knee pain and inflammation. So yeah.
Wow.
Well, I mean,
No,
these
I'm
kind of things, I
gonna,
just keep an open mind and look at it and go, okay, let's see if it works. I don't care. Like,
you know, for lower back, it's interesting you say that. For lower back pain, I completely went off and I'm passionate about this. I wish I had the time. I would open up lower back pain clinics all throughout the country, because I feel like this is another area that's really underserved. I mean, we
Hmm.
have an epidemic of people who are constantly flexed at the hip, right? They're
Yeah.
just sitting down with their hips flexed. Your hips get really, your psoas gets really tight, right? And never sort of elongates. We do no movement with an extended leg. And what happens over time, we just get, our posture becomes terrible. And
Yes.
up and down the chain, our hips get tight, and people don't realize the psoas gets tight, the hips get tight, right? And our butt falls asleep, basically. We don't have a nice strong butt to like pull down on the bottom of the spine. And then we have these like rolled over shoulders, and and lats that are weak, that are not pulling up on the spine, and what happens? Like we get surprised when our back goes out. And I feel like so many people can just be helped. Like literally, I think Stuart McGill was onto something here, and I think he's really, elevated the field of back pain. I cannot recommend enough John Sarno's work and Stuart McGill's work. And I feel like if you combine those two,
yeah, totally.
The biopsychosocial model to chronic pain, but also the mechanics of it, open up the hips, make sure the hips are nice, like strengthen the glute, right? Make sure the core is tight, the lats are strong, the posture is good. And this solved my crippling. I had 2 years. I couldn't walk for a year. I could not walk for a year. I couldn't sleep. I was sleeping on the floor, and this solved it. And I never took any pain meds. I never took an injection that told me I needed surgery. I didn't do it. And now I can kick over my head. I mean, I could kick so high. A couple months ago, I fell, So I'm a big believer that, and I was when I was in that back pain patient phase of my life, I was so vulnerable.
Yeah.
If you told me, Lindy, if you told me, Tro, PRP will help you, I probably would have done PRP. If you told me, buy my voodoo, pain thing, I probably would have done that. Because I couldn't sleep. I was constantly in pain and I wanted to get out. But I feel like this whole sort of, orthopedic, physical therapy space, really not about we need to actually show quality improvement. And I know that's been hard in the back pain literature. And I know it's been hard even in the, arthritis literature. So I'm hoping that the field and people like you can change this, right? I wish I could go, and maybe you could tell me if this exists or not. I wish I could say, well, how does Lindy's clinic compare to, HHS's clinic versus, Northwestern's clinic versus, I wish we could track results and see who's doing great and learn from them. And I just wanted to hear your thoughts a little bit about that. All that.
Yeah. Can I first ask just a couple follow-up questions? So you were saying you strengthen your glutes and you started introducing some more mobility to your hips. So what did that exactly look like? Just so listeners can get an idea. What exactly did you do to get rid of your pain and how long did it take?
It took 2 years and I stopped doing what hurt, which was loading my spine. So I completely stopped loading my spine. So the deadlift stopped. Anything that put weight on my spine stopped. I had bone marrow edema on my spine, so on the MRI, so it was bad, multiple disc disease, but just chronic pain. And so that's what it started with, just walking.
Yeah.
And then, I had an MRI. It was crazy, the amount of atrophy from 2 years prior, the MRI I had versus that one from just being in pain. And I think people don't realize that, right? Your muscles basically shrivel away. So what did it look like? It looked like 90 stretches, on the floor. It looked like, the McGill Big Three, planks, bird dogs, unilateral leg lifts. It looked like hip bridges with bands. It looked like glute bridges, unilateral glute bridges. It looked like anything that took pressure off my spine and built all the accessory sort of muscles and mobility that would protect my spine.
Yeah.
So but nobody, I went to 6 physical therapists. I went to 2 chiropractors, 2 physical therapists, an orthopedic and a neurosurgeon. And, nobody really.
You had to piece it all together yourself is what you're saying.
Yeah.
Yeah.
I don't get commission, Tro, but let me show you something. This is kind of have you seen this thing before?
You got to describe what you're seeing. So
I know it's called SoRite, PSORIT. I don't have any financial interest in these guys, but it's kind of a crazy thing. You lay on that, it stretches when my back hurts, I lay on that it's torture, but that hits your psoas and stretches it. And my back pain's gone for a week for sure. And I'm
Yeah.
old, Tro, like as you've already pointed out. But little things like that, we go, how come no one talks about that? I saw it on YouTube. I'm like, well, these guys are talking about it. I'll try it. And then my back pain instantly goes away. I'm like, okay, sorry, chiropractor. I don't see you as often, but
I
that's the
know.
way it goes.
And those kind of things, like that tool you just showed, like that's amazing, by the way. And like, quite frankly, like a lot of programs just don't teach that, or they like see it as like foo-foo medicine, right? And that kind of stuff I learned like after graduating, right? Just from other clinicians that are like, hey, back pain patients really respond well to this, right? Just like that constant learning that all of us go through, like in our careers. But like, yeah, I think Dr. Cho, I think it depends on like, like whoever you met, it depends on what they've learned and what their experience is. Like the things that you were describing that helped you were like, key tenets of the program that I went to at Northwestern, but that might look different at a different physical therapy school, right?
Mhm.
So I think it's just like any profession. Like some doctors are going to know how to help you in terms of nutrition and some aren't, right? They just probably don't know.
Yeah, I think there's something to be said about the anxiety and the vulnerability for somebody in pain. So, it's funny. Like I was just like I was eager to find out. Just can you explain my pain to me? And the first physical therapist that could, and shout out to Camisa Physical Therapy. No financial relationships. He's in the Upper New Jersey area. He sat down and he did the McGill evaluation on me, and we walked through it, and he just explained to me step by step. And I walked away from that one evaluation knowing exactly what was going on,
Yeah, that's
right?
amazing.
You
Yeah.
know, and I had worked on the sort of and knowing exactly what's going on. Well, what caused the pain? What can I do about it? How can I like that plays on the human experience, right? Versus like you got a back issue, maybe it's facet, maybe it's this, maybe it's a disc. I don't really know. Yeah, you got bone marrow edema, but who cares? Do this movement, right? I think there's something to be said about that.
Yeah, no, it sounds like you were like had a great therapist there or just took the matter into your own hands and, just, scour the internet to find out what other people were doing to fix it. Like that's okay too, right?
But
Like if
that
something
sucks that we have to do that, right? It
Yeah, I
sucks
know.
that we,
I know. I know. And like I will say like some of the stuff that you did do, like that's pretty like standard practice of care. So I'm surprised like, that you didn't get that help initially, um but I think I don't know. I think it's tricky. I think then like again, each program is going to be different. So unless it's like standardized among, and it probably should be standardized among PT schools, like this is what we learn. But sadly, like that's just not the case.
you were trained in sort of McGill's about the way McGill sort of preaches evaluation for lower back pain, which I learned so much from him and his lectures and his books.
Yeah.
I thought it was fantastic.
Yeah, I mean, I think we learned, just like there's different pain generators for the back, right? Like if an 87-year-old woman has pain, it might be because like she has spinal stenosis, right? Versus, 35-year-old Dr. Tro, has pain from like a disc putting pressure on his nerve, right? So the treatment approach is going to look different. And if it looks the same, you're not really addressing the root cause. So you just have to carefully listen to the patient's subjective history and, try to put the puzzle pieces together about like, okay, I think this is what's causing your pain. So we're going to try this approach. So like a McGill approach won't work for every low back pain patient. Does that make sense?
100%. Yeah. I
Yeah.
wish, yeah, I just wish I felt I had more faith in just like you lost faith in the physical therapy community.
Yeah.
I wish I had more faith, but you give me hope. So,
I mean, I think, and also just remember the name of the clinic that helped you, right? And go back to them. Or if this pain comes back, like let's say life gets busy or off your routine for a little bit, go back to those things that worked before, right? You don't have to run to the therapist. Like you can just do it on your own at home and it'll probably go away. And if you can't, then go seek help.
yeah, absolutely. Keep seeking help. I seek help all the time. I think I got to work on the brain next. Yeah.
Don't we all?
Yeah. Awesome. Well,
Bro,
this
you
has
ended the
been
conversation with your brain, man.
Well, yeah, no, this has been an awesome hour here. I think we'll wrap it up here, Dr. Lindy, and I'm super excited you joined us, and I'm so grateful that you came on, and I hope the listener can take a little bit from my years of pain and your years of knowledge and education, and hopefully they can get a little bit and take something out of this. And hearing, how you lost hope and hope, in the medical system is just echoes what we've seen, and hopefully we can regain some hope and reestablish some trust in the medical system. So I'm hoping that when you finally open your clinic and break free, you'll come back and let us know about it.
Yeah, we want to promote that because I have a cash pay physical therapist I use in San Diego. Unbelievable results, gets people like better quickly, and it's amazing. And people get
Yeah.
back to their life. And sometimes, I mean, I'm telling you, at least in San Diego, it's a mill, and they go over there, go use that machine. I'm gonna go
Oh,
do over here with this person, and we'll have an assistant check on you in
yeah,
10 minutes. It's like, what am I
totally.
doing? I can go to the gym and do this.
Absolutely.
Yeah.
And quite frankly, like what I do next, it won't be related to physical therapy and it'll strictly be related to metabolic health, right? Because I think that a lot of physical therapists that'll teach you how to strengthen your body, but not very many who know how to like help you with your actual metabolic health. So that's the direction I'm going to go because I think that that's where we have to start, right?
Awesome stuff. Yeah,
Yeah.
Awesome.
great. Excited for you. When
Thanks for
that happens,
coming.
let us know and we'll get you back on. We'll talk about what you're doing.
All right. Thanks,
We'll,
guys. Such an honor to
we'll,
be with you guys.
Thanks for
yeah,
joining us.
we'll put all the contacts in the show notes on social. Maybe you could just send me the YouTube channel so we could put it as well.
Absolutely. Thank you so much. Have a wonderful day, guys.
If you enjoy the show, please consider supporting us on Patreon by going to lowcarbmd.com.